So, welcome back, everyone. As per usual, I am your host, Michelle, and today Luca is joining us, our in house expert, the founder of Sparked on everything artificial intelligence. Okay, so today we are going to look into the question of healthcare and like what can AI do for healthcare? We're going to go
Well,
through a number of samples.
yeah, thank you, Michelle. This is a fascinating topic, and the applications are very, very abundant. I mean,
Hmm.
I'm going to mention a couple, but there's so much that machine learning can do here. The challenge is that when we're talking about health, uh, there's an extra layer, well, a couple of extra layers of complexity. Number
Hmm.
one, it's about data privacy, and number two is
Yes.
about responsible AI. Okay, because here we're
Hmm.
dealing with a lot of confidential data and a lot of important data. Important decisions are taken using these algorithms. So the applications so far haven't been straightforward. Okay, to my
Hmm.
knowledge, I think radiology is one area where computer vision, in particular, can really make a difference. And the ability to analyze images through pattern recognition, it has been there for a long time. And I think that the objective here is not to replace the doctor or the radiologist. The objective is really to speed up their work so that they are able to focus their time on the areas of the process where it matters the most. Okay.
Yes, and I've heard there's an interesting company based in the States. I think it's San Diego, and they're doing something on machine learning. And I think it's for mammograms. Can you explain a little bit? Have you heard of them?
Yeah, I think I've heard of them. I think they are applying natural language processing and advanced machine learning
Hmm.
to probably mine the abundant textual data that is surrounds the patients everywhere now. I mean, digitization is a process that is changing the industry. So
Hmm.
majority of the data when you're getting into an hospital is on a digital records, and I
Hmm.
imagine that Metrics is applying an awful lot of those techniques to really understand what's going on at a aggregated level. So if there are common patterns among patients with the same condition. So I don't know the details, but that's broadly speaking what I think they're doing.
Yeah, it sounds very interesting. I do think, from what I remember, it is a matter of if they see the patterns early enough, they're able to put in an intervention where it matters most. So early stages, basically.
Okay, interesting.
And our next example.
Yeah, we've during your research you surfaced an interesting example, always in the area of computer vision,
Hmm.
which is about pathology analysis. So
Hmm.
I'm not an expert, but I know that pathologists look for specific cues into tissue samples. They do it with
Hmm.
microscopes, and I imagine that this is a significant time investment. So if
Hmm.
again we were able to speed up their work with an AI that essentially does the heavy lifting or does the pre-screening phase or even flags samples that are suspicious for a second review, second human
Hmm.
review, that could really improve the workflows and bring a lot of value to the doctors and to the patients.
Yes, I can imagine. I think for that example, the project is being headed by Memorial and Sloan Keating, something like this. So they're
Hmm.
the oldest private center in the world, and they're based in New York. And one of the things is that when you have a facility like this that has like a lot of funding and there's a lot of money coming in, and they're able to actually experiment and see how can you use AI in this way, it cascades to the rest of the world really well because then they do the trial and error, and then when they figure out how to do it, they can just give out the information and the other health centers can do with it as they please. It's really cool.
Certainly. And let's not forget that the name of the game is data.
Hmm.
Therefore, if these institutions are able to collect, anonymize, and share uh, data sets and data samples, then their whole research community can benefit and can bring forward the research in this very interesting area.
All right. So cool. Okay. So for our last example.
Yeah, we were talking about individualized and precision medicine, and this is
Mhm.
a pure machine learning problem, uh, which is actually pretty straightforward if we define it, but not so
Mhm.
straightforward to solve it. So you have a patient um, affected by a disease, and you want to determine the optimal combination of treatments that have to be received by the patient. And this set of recommendations uh, should be individually conceived for each patient, and this is the non-straightforward part. Typically, a doctor does that to some extent, but here we are really talking about taking a very, very deep profiling information about the patient, including whatever attribute you can imagine, demographic, sociological, or yeah, whatever you can imagine, and then devise that strategy. So this is probably the most advanced use case. I never really dived into this one, and I've never seen so far any technology solving this
Mhm.
problem. But yeah, I'm really looking forward to study more about this and then come back in another 101 question of AI episode and share more about this.
Yes, indeed. This is probably an example that we'll have an entire episode on, in particular, because of just how consequential it is. Like personalized medicine, that is the purview of people who have the money to actually get all the different types of doctors to look at all the different sets,
Yeah.
right? But if that is something that you can model into a system, that is a benefit that we can pretty much give out to society at large. So it's pretty cool.
Yeah. Well, thank you, Michelle. Thanks for bringing these examples to the episode. Would like to thank all the listeners and all the viewers on YouTube. If you like our content, please subscribe and hit that like button. Thank you very much.
All right. Bye, guys.